Okay, so it looks like I have one more patient for today, and they are here for a cranial nerve exam. And it looks like they're going to get here right about now. Hello, my friend. Are you here for a cranial nerve exam? Alright, well, nice to meet you. I'm Dr. Amdia. I'm going to be doing your cranial nerve exam today. So before we get started, I do just have to confirm a couple things in your medical record. So first of all, can you confirm your first and last name for me, please? Okay. Okay, and how do you spell that? Okay. Alright, perfect. And your date of birth? Okay. Alright, perfect. Are you on any medications? Okay. And the dosage and frequency? Okay. Got it. Any allergies that I should be aware of? Okay. Okay, perfect. And can you tell me just a little bit about what brings you in for a cranial nerve exam today? Okay, you hit your head. Perfect. Okay. Okay. And have you ever had a cranial nerve exam before? No? Okay, okay. So a cranial nerve exam is essentially testing your five senses, as well as some of your muscular function. Okay, so let's go ahead and get started with your sense of smell. Your sense of smell. Okay. So to test this, I have several different fragrances, and I'm going to be spraying them on these Q-tips and then letting you smell them. Okay, so here's our first one. Okay, go ahead and give that a sniff, give that a smell, give that a little bit of a smell. Okay, and what do you smell? Coconut. Perfect, perfect, perfect. All right. Okay, now it is very important between smells that we cleanse your palate, because I don't want you to be smelling coconut when we go to do the second smell. So I have some coffee beans, and coffee beans are really, really good for clearing that sense of smell. So between each smell, I'm going to let you give these a little whiff. Okay, so let's go ahead and open this up and go ahead and give that a sniff. Give that a sniff. Okay. Are you feeling like your palate is nice and cleansed? Yeah, okay. All right, let's move on to smell number 2. Okay. Here is smell number 2. Smell number 2. Alright. Okay. And go ahead and give that a smell. Give that a smell. What do you smell? Strawberry. Absolutely, absolutely. Okay. Okay, now let's go ahead and give these coffee beans another smell. Go ahead and clear that palate. Okay. Okay. Do you feel like your palate is nice and cleansed? Yeah, okay, perfect. Alright, so our third and final smell. Alright. And give smell. Give that a smell. Alright, what do you smell? Chocolate. Absolutely, absolutely. Alright, so your sense of smell seems to be intact. Your olfactory nerve seems to be working just as it's supposed to. So we're going to go ahead and move on to your next sense, which is sight. Sight. Okay, so first I'm going to be checking the actual health of your eyes themselves. I'm going to be looking, make sure that all the tissue and everything there looks healthy, okay? So I'm going to use my handy dandy pen light. I have a pen light. It's a little bit of a pen light. So for this, I'm going to need you to look right at my nose. Look right at my nose. Look right at my nose. And I'm going to look at your eye. Okay, good. And look right at my nose. Look right at my nose. Look right at my nose. And the other eye. Okay, perfect. One more time in each eye. There we go. Okay, and the other eye. Okay, perfect. Okay, your eyes are dilating exactly as they should. I love that for you. We are now going to check the motion of your eyes. So can you look up for me? Look down. Look right. Look left. Okay, perfect, perfect, perfect. I'm now going to have you follow the light, okay? So keep your head still. Keep your head still and just follow the light with just your eyes, okay? So here we go. Follow the light. 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 Okay. Follow the light. Okay. Okay, perfect. You're doing so good. You're doing so well. Okay. Perfect, perfect, perfect. Okay. Okay, so this next test is super, super simple. I just need you to tell me which hand is closer to you. Okay? So is it the right or is it the left? Okay, so in 3, 2, and 1, which hand is closer? Perfect. 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 Which hand is closer? Yep. Perfect. Which hand is closer? Okay, which hand is closer? Perfect. Which hand is closer? Okay, good job. Okay, so now that we've tested the motion of your eyes, we are now going to test the peripherals of your vision, okay? So for this test, I'm going to need you to look right at my nose, look right at my nose, look right at my nose, and I am going to start with my fingers in your vision, and then I'm going to move them away, okay? And you just let me know when you can no longer see them, okay? All right, perfect. 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 Okay. Good. 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 Okay. Okay. Perfect. Yep. Yep. Okay, perfect. All right. Now this one is kind of similar. I'm going to need you to keep looking at my nose, just my nose. Don't look anywhere else. Just look at my nose. Look at my nose. Keep your eyes on my nose. And I'm going to hold up some numbers, and I need you to tell me how many fingers I am holding up, okay? So ready? Let's go. How many fingers am I holding up? Perfect. That was 5. How many fingers am I holding up? Perfect. That was 4. How many fingers am I holding up? All 10. Perfect. How many fingers? Okay. How many fingers? Yep. How many fingers? fingers? Perfect. How many fingers? Perfect. How many fingers? All right, awesome. Okay, now I know this might be getting old, but I'm gonna need you to keep looking at my nose, okay? Don't look anywhere else, just at my nose. Look at my nose. Look at my nose. Look at my nose. I'm gonna hold up my fingers, and I just need you to tell me which side wiggles, okay? So ready? Let's go. Perfect. Good. Yep. Perfect. Yep. Okay. Both. Okay, perfect. I tried to trick you. Good job. Okay, so now we have checked the health of your eyes, we have checked the peripherals of your vision, and we have checked the movement of your eyes. So now we are going to test your actual vision and how well you can see, okay? So we are going to do that with the Snellens chart behind me. Okay, so what is this letter? E. Perfect. What is this letter? F. Perfect. What is this letter? T. Perfect. Okay, so now I'm going to challenge you to read this whole line. Okay, so starting at the left, E, D, F, C, C, and P. Okay, perfect. So your vision seems really good. We are going to check one last thing. I'm going to do a very quick color assessment with you to make sure that you are not colorblind. Okay. What color is this? Perfect, that's blue. What color is this? Green. And what color is this? Orange. Okay, perfect. You are not colorblind. Great job. So our next test, we are moving on to your sense of taste. Okay. So I have in this file just a little drop of something that is either spicy, sweet, or sour, and I need you to tell me which one it is. Okay? Alright. So just a dab will do ya. Okay, go ahead and open wide, and okay, was that spicy, sweet, or sour? Yes, correct. That was very spicy. I'm sorry I had to do it to you. Okay, so now we will get our second taste. So you know we've already done spicy, so this is going to be either sweet or sour, okay? So ready, and open. Okay, was that sweet or sour? Sour, very good, okay. And our last taste. Okay. Yeah, that was sweet. You may have been able to figure that one out by process of elimination, but it's still good that you could taste it. Okay. So we have covered smell, vision, and taste. So we are now going to be moving on to hearing. Your sense of hearing. Okay. So our first hearing test is I am going to whisper some words in your ears, and I just need you to repeat those words back to me, okay? Okay, so our first word, relax. Relax, perfect. Okay, second word, pineapple. Pineapple, good job. Okay, and our third word, happy. Good job. Okay, perfect. Okay, so for our next hearing test, I am actually also going to be using our handy dandy pen light, and I am going to be clicking it on and off, and I want you to tell me how many clicks, okay? Alright, so ready? many times was that? 9, exactly. Okay. And our final hearing test, I am going to need to put on a glove. Okay. So for our last hearing test, I am going to have one gloved hand and one bare hand. I am going to make sounds right by your ears with either my gloved hand or my bare hand. And I want you to tell me which hand it was, okay? Alright, so let's go ahead and get started. Gloved, exactly. Gloved, perfect. Bare, perfect. Gloved, okay. Bare, okay. Bare, okay. Gloved, okay. Alright, that one was both. Okay, perfect. Okay, now our last sense is your sense of touch. So for that, I'm going to go ahead and glove up on both hands. Is it okay if I touch your face? Okay, perfect. So, before we get into your sense of touch, I am just gonna examine your face real quick, make sure there aren't any obvious lumps or bumps, okay? Alright, so let's start right up here. Alright, perfect. Moving down your face. Okay, and under your neck. Okay, and feeling your lymph nodes. Okay. Alright, everything feels good. I am not feeling any lumps or bumps or anything obvious wrong with the muscles in your face. Okay, so now we're gonna go ahead and get to your sense of touch. Okay. So to do that, I have a little tool here. I have a little tool. It's a little tool. And this end of it is sharp. This end of it is sharp. And this end of it is soft. This end of it is soft, soft, soft. Okay. So while you still have your eyes open, I'm going to just poke you with each end so you can see what they feel like, okay? Okay, perfect. So that is the sharp end. And that is the soft end. Okay, so you feel a difference? Okay, perfect. doing so good. Okay, so now that we have tested all five of your senses, we are gonna move on to testing the actual function of your muscles in your face. Okay. All right. Perfect. Okay. So the first thing I'm gonna do to test the muscles in your face is just have you make a couple common facial expressions. So first, can you smile for me? Very, very big. Smile for me as big as you can, as big as you can, as big as you can. Perfect. Okay, now can you raise your eyebrows for me? Raise them up. Alright, perfect. Can you wink with one eye? Can you wink with the other? Alright, perfect. You don't actually have to be able to do that. Okay, now can you puff out your cheeks? Alright, and I'm just gonna... Okay, that looks good. Alright, now we're gonna test some of the muscles in your neck and face. I'm gonna be pressing against one side of your face and trying to turn it one way. You're gonna be pressing the other way and trying to turn me the other way. So if we're pressing equally, we should stay exactly in one place. Does that make sense? It does. Okay, perfect. So let's go ahead and start with this side. Okay, so in 3, 2, 1, push, 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 push. And don't let me push your head. Don't let me. Okay, perfect, perfect, perfect. Alright, and the other side. Ready? 3, 2, 1, go, 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 go. Push, 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 push. Okay, perfect. Alright, let's do it one more time on each side. Ready? Okay, and push, 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 push. Don't let me turn your head. Don't let me, don't let me, don't let me. Alright, good. And one more time on this side. Ready? And push, 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 push. Okay, perfect, perfect. Alright, now we're gonna do the same thing for the muscles in your arms, okay? So I'm gonna grab a hold of your arm if you don't mind. Okay, perfect. Now you are going to push against me and then pull me towards you, okay? So ready? 3, 2, 1, push, 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 push against me, okay? And pull me towards you. Pull, 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 pull. Okay, perfect, very strong. Alright, and this side, ready? 3, 2, 1, push against me, push, push, push. Okay, and pull me towards you. Pull, 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 pull. Okay, perfect. Whew, very strong. Okay, so now the last thing we're going to do that with is the shoulders, okay? So I'm going to be pushing down on your shoulders. You're going to be shrugging up, and ideally we should stay right in the same place, okay? So ready? And 3, 2, 1, push, 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 push. Okay, don't let me, don't let me, don't let me. And relax. Alright, one more time for the shoulders. Ready? And 3, 2, 1, push, 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 push. Okay, and relax. Okay. Alright, my friend. Well, that is it. That is all 5 of your senses, and it is your muscle function.